Hello, welcome to this High Yield Clinical Education's YouTube channel. I'm Boon Singh. Today I'll be talking about the approach to bleeding disorder. And this mini lecture is specifically catered for undergraduate medical students doing their internal medicine rotations. We have three learning outcomes. Number one is to describe a logical and practical approach to assessing patients with bleeding disorders, list a differential diagnosis of the symptoms, describe the overview of the management of specifically immune thrombocytopenic purpura, von Willebrand disease, and hemophilia. To understand the lecture content, it will be prudent to recall your prior knowledge on primary and secondary hemostasis, the role of vascular endothelium, platelet, bone marrow coagulation factors, and the synthetic functions of the liver. The assessment of the patients with bleeding disorder follows a predictable sequence of history taking, physical examinations, and investigations. For history, we will be assessing the patient's bleeding history with the International Society on Thrombosis and Hemostasis Bleeding Assessment Tool, ISTH-BAT. You do not need to memorize all the components of the screening tools, but just simply launch the online calculator that is available. We will need to take a detailed personal bleeding history, that is the bleeding events from childhood to adulthood, and significant family history of bleeding disorder. We should take note of their surgical or dental histories, whether the patients will need for previous iron therapy or a transfusion. In menstruating women, do ask about the symptoms of menorrhagia, such as passing out blood clot per vagina every menses. For the past medical history, you should ask specifically for liver or kidney disease, alcohol consumptions, features of hypothyroidism, and autoimmune disorder, such as systemic lupus erythematosus. And we should not forget to take the medication history and ask about the consumptions of antiplatelet, such as aspirin, clopidogrel, ticagrelor, anticoagulants such as warfarin, apixaban, rivaroxaban, dabigatran, and edoxaban, the use of the NSAIDs and corticosteroids.